guys, I'm about to show us how to give personal care in the morning to the residents, you know, how to give them a wash or shower or bed baths. So I'll be using my brother as the resident, me as the carer. So in the morning I will be coming with sometimes they have these things in their bathroom, you know, so you don't have to just be coming in with it. It all depends. I don't know how your care home or where you are working, I don't know how it works, but most times they have it in their bathroom. But before you start, like you have entered there, before you start, you have to get these things ready: the soap, the cream, the towel. You have your PPEs, the gloves, the face mask if necessary, and your apron to cover yourself, protect yourself. So here I have my wipes, which I will put in the water to, you know, to wash the person if it is bed bath or wash. If the person can go to the bathroom, you take the person straight to the bathroom. Normally, you give the person shower like the way everybody can have shower and everything. So we'll start. This is how we come in. First of all, before you come in, you know you dignity always. So we'll start now. Oh, he must still be here. Hello, Mr. Patrick, good morning. He will answer you good morning. Sometimes they will not answer. Are you okay? This is Juliana. I'm here to give you a wash. Are you fine with that? Yes? Sometimes they will answer, sometimes they will not answer. Now, remember, everything I will need, I already get it ready. Okay? So, I will move to this place. I'm coming. So, I will move to this place and do what? If the windows are open, you do what? You shut the windows down. Close the curtain to protect the person's what? Dignity. You can put the light on. So that nobody from outside or neighboring houses or whoever will see what you are doing inside. You have to protect the person. The nakedness, you protect it. But I have to open the curtain now because, you know, we need to see what we are doing very well. So yeah, the next thing is, yeah, you can put it on. The next thing is the residents. Akatuku. Yeah, so we have our residents lying down on the bed now. So I'm going to give this resident shower because he already said, okay, you can do it. And here I have my gloves on. I should have my apron. I don't have apron here. I'm not at work. And nose mask if necessary. So I will have to seek for consent before I take off their blanket. You understand? So I need to ask, are you happy for me to take off your blankets? Some of them are like this. When you want to take it off, they will take it back because why? They are not ready yet. Maybe they still want to sleep. You don't have to force the person. Sometimes you need to prompt them. You know, you need to start telling them, you need to have your breakfast. You need to come and have your wash so you can eat. Remember, you have to take your insulin. Remember, the district nurse is coming to see you. You know, you have to prompt the person. You cannot just, because they take their blanket back, you not leave them and say that they don't want to bath. No, you have to try. Okay, Mr. Mishak, please, can I give you a wash so you can have your breakfast?
It's not
challenging behavior. So, after everything and they have agreed, so we have to move on. Now you have to take the blanket off. Take the blanket off. You understand? I already have my soap and everything. Of course, they used to have it in the bathroom. I just bring it out for you to see. So you have to have all these things close. You understand? And the towel, I think this will serve as my towel. and my towel, everything. Because you know we are going into winter. You don't want to wash somebody and you don't have towel. Before you go and get it and come back, the person is already shivering. So we don't want that. So I have my continence support, the pad that I will use to, you know, put here. And I have my distance, my wipes. You can put in the water and the soap to wash the person on the bed. But if this person can go to the bathroom, you don't have to wash them on the bed, except they want to. Okay? So you already know how to do it. When you get the wipes, you just, like the way they are lying down, you wash here. After washing here, you use the towel and dry. After drying, you put cream. After that, you tell the person, can I wash this side? The person will turn. Now, if that person is a resident that requires double, of course you should be two. So that when you turn the person this way, another person will be by that side to hold the person while you wash. But if that person is not double, they can turn on their own. So when they turn, you continue washing. But most times you wash them in the bathroom. This is a case where someone doesn't want to go to the bathroom or they are bed bound. You understand? You can't take them to the bathroom. So that's it. After you finish washing and everything, applying cream. Make sure you dry them properly and apply cream. Now you have to put a pad. This pad is very big, not like this is baby's own. So I can shift to go. My God. Shift to so most times they lie this way with their face up. So how do you put this in? Someone that is like this, how do you put it? You just have to move the person this way. Move the person this way. You put the pad like this and bring the person back. When you bring the person back, of course, the other side will come out. The head will come out this way. Remember, you are not meant to bend down. A resident you will attend on bed, they have bed control that you can use and raise it up so you don't bend down. Because when you bend down, you break your back. Yes. You might be doing it and you think it's nothing is happening. After like 2-3 months, you find out that you have back pain. So you don't bend down like this to do it. No. On a way, it has control that you will use to bring the bed up to this level that you don't have to bend down. Okay, so you don't bend down. I'm only bending down because what we are using is down. So now you have the pad coming out here. You now bring it up like this and you wrap it up. And that's it. She doesn't allow us to teach. I hope you understand. Now after that, you dress the person up, you put the trousers, turn the person that way, bring it up, put the t-shirt, and that's it. Anything you want to do and the person is sitting this way, you have to move that person that way so you can, bring it up. And if you want to raise the leg, this is how you do it. I hope the leg is showing good. If you want to raise the leg, this is how you do it. You bring it up, keep it this way, okay, and do whatever thing you want to do. So that is how to do it. And remember, when you are doing it, it's because I'm teaching, that's why I'm not talking to this person. When you are doing it, you'll be talking to the person. A kind of like after washing, you dry the person. You ask, do you feel dry? They are the person that owns their body. They know if they are dry or not. Sometimes they will tell you yes. Sometimes they will tell you here. Sometimes you give them, do you feel dry? You offer them the towel to dry wherever they feel they are not dry. Because you cannot do everything for them. You doing everything for them means that you are taking away their independence. So except if that person can no longer help at all. But if the person can at least help, after drying, you already know that you are finished drying. Just give them the towel. Do you feel dry? Do you feel wet anywhere? Take the towel and dry it. Sometimes they will take it and they will tell you they feel dry, they are dry. Now you apply cream. If the person is sitting down, you can give the person to, just trying to involve the person in what you are doing. So it won't look like you are just doing it all alone. You try and involve the person in what you are doing. Now after that, I have finished washing this resident. It's time to put on clothes. It is not 100% good to just go to the wardrobe and make a choice for them. Like I said before, if they have got, they can still recognize something. You can bring 2 different clothes for them and say, do you want this or that? Sometimes they can choose. Sometimes it is good to take them to the wardrobe to make their choice. These are ways you involve them in the services or in their care. Now after that, you put them their socks and their shoes. We are going into winter, so it is necessary you cover them properly so they don't get exposed to cold. Put them their shoes and their socks if they've got one. If they got one, you put it on for them. Now you take the person to the dining where they are eating. If they are going to the dining, some of them would like to stay back in their room. You just sit them up in their room, sit them up and get their food for them. So that's it. And after that, the gloves you use to wash the person or whatever, you take it out. Okay, you see what I'm doing? You take it out, like putting your hand inside and bringing it out. You understand? You find out that everything have gone inside there. You throw it away. Same thing with your. Normally it's best to first of all take off the apron. After taking off the apron, you are still putting on the glove before you take off the glove. So that's it. And you tidy up whatever thing you have used to care for the person. This thing still depends on the practices, how they do where you are working. So it depends on, somebody will be there to guide you as a first-time person. Somebody will be there to guide you, or when they are doing it, you look and see what they are doing. So that's it. But remember, before you come into a residence room, it's good to give a knock on the door. You understand? When you come in, you greet the person. Hello, Mr. Whoever. Good morning. Hello. And you reintroduce yourself, because sometimes, most times, they don't know what you are coming to do. So it's good. Hello, Mr. Dispatch. Hello, Mr. Misha. This is Precious. Hello, Mr. Misha. This is Juliana. Are you okay? Sometimes they will respond. Sometimes they will not respond. I want to help you with wash. Are you happy with that? You just a kind of seeking consent, telling them what you want to do. At the same time, seeking consent if they want you to help them and do it. Sometimes they will say no. Sometimes they will say yes. Because they said no, it's not enough reason to neglect them, to leave them. No. You do what is called prompting. You prompt the person. There are some cases where a resident will be in poo, like they poo or they wee, anything. You'll be trying to get the person out. They will refuse. All you need to do is to let your colleague know about it and do what is called best interest, because you can't leave them in the pool. But this time around, you don't have to do it alone. You don't have to do it alone. You have to get other people involved so they can help you and do it. So that is it for the personal care. And yeah. Now when it's time to feed the person, if the person is the resident that you will feed, when it's time to feed the person, you have to know the type of food they eat. If they take liquid one, if they take solid food, you have to find out. So you don't give the person what will show the person. Always ask questions. Always ask questions until you know what they are doing. Always ask questions.